So welcome to the 2013 CADCA Forum, which is our 23rd one. So congratulate yourselves and welcome. Thank you very much. Welcome. We have over 2,500 people, and the numbers continue to grow. So we're delighted that so many of you could travel from far parts of the world to be with us. We have nearly 300 young people, our youth leaders, here as well. So congratulations to them. I often am criticized for not telling you who's speaking to you, so I will do that this morning. I am Arthur Dean, the chairman and CEO of CADCA, and I want you to know that I started this journey with you the day I retired from the military service, and that was August 31st, 1998. So I've been on this journey with CADCA since then. It's been a wonderful second career, and I have thoroughly enjoyed you, the opportunity to serve you, the opportunity to work with you and travel this great land to include the world now as we are doing international work. It's been my pleasure. But the first order of business, as I said to you, I'm going to try to moderate this morning and also give some comments and introduce our wonderful guest speakers. But there are a few conference etiquettes that I would like to politely and gently share with you this morning. But A would be, we would want you to enjoy and appreciate your speakers. You're going to have lots of them this week. And one of the ways to do that is to be punctual, to be on time, to be respectful as they are presenting and sharing with you, and hopefully remain with them until the session has finished. And that's not just for the large sessions that we're having this morning, but that's for everything throughout the conference, whether it be a workshop or whatever it might be. And I know that you will do that. That's the kind of people that you are, and I appreciate that very much. B would have been talking about time. I've already talked about that, so I'm not going to bore you with that anymore. But we have so much that we want to share with you, and if we don't get started on time, we'll never get it done. And it's important that we do that. So, and C, I know that everybody, most of you now have smartphones. You keep them with you all the time. You need them to be able to tweet questions to the speakers. But if you would silence them or put them in a mode that would not interfere, we would appreciate that. And hopefully you've downloaded the Forum app as well on your phones, and I hope you are appreciating that and enjoying that. And if so, let me know that. Are you enjoying the app? Good. Well, we have people here from as far away as Palau. We have people here from South America. But I got to tell you that the Empire State, the great state of New York, has the largest number of attendees, almost 150. So let's give them a hand. The great state of New York. Congratulations. Thank you. Also, we started a program a few years back called Vet Corps, where CADCA is putting former military members or their spouse into our coalitions. We are filling 100 positions that we got from the Corporation of National and Community Service. We are almost there. We have 75 of the 100 coalitions already identified, and about 35 to 40 of those people were able to join us as well. So let's congratulate those that are helping our coalitions build strategies in their community to receive back our veterans, their family members. We are so excited. Thank you very much for that. Also, I want to thank our partners This forum would not be what it is without them. They are on the signage all around the forum. They're in the program booklet. They're so critical and so important to us. You know exactly who they are, and if you have the opportunity to say thank you, I would appreciate that. And we want to thank SAMHSA for kicking off the forum yesterday with their Community Prevention Day. It really was a wonderful day, and thanks to SAMHSA for doing that. So quickly, you notice that the theme this year is about coalitions, science, strategies, and solutions. We selected that theme not just because it sounds catchy, but because it is more critical than ever that we act strategically. It's important that we do that we base our work on evidence and science so that we can get to the appropriate outcomes, and that we find comprehensive solutions to solving the problems associated within our communities. CADCA has always and continues to support a holistic approach to preventing the use of illicit drugs, underage drinking. We're doing a lot of work in youth tobacco use, and the abuse and misuse of over-the-counter and prescription medicines. That's what we are concerned about. That's what we're trying to do, because you and we understand that these are significant public health challenges that are impacting our communities in a very negative way. Now, we also understand that treatment is important, and we know that treatment works. It's effective. It's critical that we keep people on the road to recovery, keep them on the recovery road so that their lives can continue to be successful. And we are all about ensuring that they do not relapse. So we are concerned about the whole continuum, from education to prevention, intervening when appropriate, getting them into treatment, causing the treatment to be effective, and keeping them on the road to recovery. It is critical that we care about all of that. But we understand that by preventing drug use from starting and the abuse of these substances, we can reduce the number of people that suffer from the disease of addiction. We can save lives, and in fact, we will allow these young, great leaders that we have here with us and others like them back in their communities to be able to grow and learn and receive their God-given potential. That's what it's all about. That's what it's all about. Dr. Noah Volkoff, and most of you know who she is, she's the director of NIDA, says it best, that regular marijuana use stands to jeopardize a young person's chances of success. She says in her research that about 9% of those that begin to use marijuana at a normal age, probably around the 18th years or later, will become addicted to marijuana. But also she says in her research that if they start using it around 11, 12, or 13, which is what's happened too often, then their chances of becoming addicted increases substantially to about 17 to 18%. So we're saying if young people start using it around 12, then the chances are that 2 out of 10 will become addicted, and we cannot afford that. Therefore, it's important that we have in place the appropriate policy, practices, and procedures to ensure that we are helping our young people make right and smart decisions. We know what happened in a couple of states in the U.S. I need not tell you that. You know what happened in Washington and Colorado. We have lots of workshops this week to help you address the issues back in your community. And we actually have a special one, dialogue on Wednesday night from 7 to 9 that is going to deal specifically with that. We're going to have Dr. Kevin Sabet. They're talking about his new initiative, SAM, Strategic Approaches, Smart Approaches to Marijuana. John Redmond from California is going to be in that discussion, as well as our own Sue Thaw, so I would invite you to take advantage of that. We know that it's sad, but it's true, that more 8th, 10th, and 12th graders smoke marijuana than cigarettes, according to the latest CDC risk behavior survey. That 23% of high schoolers have reported that they smoke marijuana, compared to 18% that have smoked cigarettes. So we have a real challenge on our hand. You know, but of course it doesn't have to be this way. And we shouldn't throw up our hands and give up either. We are a very resilient force. We understand that when things are tough, we need to begin to act strategically, change the conversation, make sure people understand the public health associated with this issue. And there's history on our side. If you look back, and I know many of you were not here then, back in the 70s and 80s, regular drug use in the United States was about 15%. It's less than half of that now, although we have all of these challenges. But many of you do remember what we were able to do in the 90s when we drove down youth marijuana drug use. So history says that when we come together as a nation, implement evidence-based strategic strategies, we can make a difference, and I'm convinced that we will make a difference. So let's not give up, let's not throw up our hands, let's go to work, and let's change our communities. We can do that, and we will. I like to tell my good colleagues at CADCA, stay ready, stay prepared. Americans in general are going to understand we are needed. And when they come to us, we got to be ready. There's no time for us to prepare. We will have to get ready, and we'll have to be prepared to do that. You can kill that slide. That was one that caused me to strike out on the first pitch. So the bottom line is, we can make a difference, and we will make a difference, and it's important that we do that. So we got to start by changing the conversation. We got to make sure that everybody understands that this is a public health issue, and there are consequences associated with it. We want young people to what? We want them to finish high school, and many of them are not doing that. We want them to be employment ready if they're going to go directly into employment. We want them to be college ready if they're going to end up going the route of college. If they want to join the military services, we want them to be ready to do that. And if we are not diligent in our communities and change the conversation and get them to not use these substances, then they will not be able to do that, and we will have a very difficult time in this country, and that we do not want. So I want you to enjoy your week. I want you to learn, take advantage of all that we've prepared for you. More than 90 workshops, lots of plenary speakers. All of our good friends that run federal agencies will be here conducting power sessions. I want you to avail yourself of them. And I want you to go back ready to charge and to continue to work to improve your community. I know we can do it. We've done it in the past. We will do it again. So let's make it happen. Thank you very much. I want to introduce a good friend and have him come give some remarks this morning. But it's my honor to introduce a true friend of the Coalition Phil, a great supporter of CADCA, and that is Director Gil Kerlikowske. Director Kerlikowske has been the director of ONDCP since 2009. He's traveled the U.S. He's visited many of you because he really wanted to know you and learn you, and he felt that being out visiting you would allow him to do that. You fully understand that he's responsible for the National Drug Control Policy. He's responsible for implementing and putting together the President's National Control Strategy. Gil, you'll be surprised by this, but he's been the chief of police in many, many major cities. I often kid him about starting so young because he has spent more than 37 years in law enforcement. Most recently, before coming to Washington, he spent 9 years in the city of Seattle, Washington. He doesn't like for us to talk about it, but when he left Seattle, Washington, crime was at its lowest rate in 40 years. So he understands law enforcement. He understands the needs of our communities. He understands the drug problems that we have in this great country. And it's my pleasure, and let's give a warm welcome to the Director of ONDCP, Gil Kolakowski.